Okay, so these exercises are designed to help get the midfoot moving a little bit more. They're focused specifically on everything below the knee, and we use other things to drive these movements, but ideally we're trying to get the arch to rise and fall, and then teaching the body how to control pronation and supination in a way that we can do both safely, ideally while running. So if I'm playing this at half speed, you'll see that I step forward with my left foot and then drive my right knee over my toes, creating dorsiflexion of the ankle. That's a really required and necessary movement of the ankle to run safely. And you see right at the end my heel pops up. You want to push it to the point where you feel your heel come up off the floor. And no need to go any further than that. And so you're going to drive that a couple times. You can do it with all your weight on the right foot or just part of the weight, depending on how you feel. And then the next one would be rotating. You're going to be then moving your body in the frontal plane. So you're going to move your knee to the right and the left. So when you move to the left, and I'm putting my left toe just for balance, tapping it on the ground. Still 85% of my weight's over here on the right leg. But you can see my right knee is bent, and I'm creating pronation of my right foot. As we go the other way, you're going to see my knee then go to the right and then back. Here's the knee going to the left and bending, and then as I go to the right, I pause. My knee is still bent slightly, but my knee is outside of my toes. So I'm moving my knee in the frontal plane back and forth, creating a supination of the foot in this position. And going back the other way, there's a pronation as I go back to the left. So the next part that we haven't talked about is rotating your knee to the right and left and how that affects the foot. So here, we're rotating the body and the knee to the right, creating supination of the right foot. And then as we rotate to the left, we actually keep that, it's important to keep that right knee bent, but then the knee will rotate slightly and create an unlocking of the midfoot and make you pronate. So if you are feeling knee pain in this particular instance, you want to make sure that you're bending the knee. If the knee is locked, you're going to feel pain on the inside part of the knee. So the first part was to teach us how to have mobility of that ankle. Now we're trying to train a little bit of stability. So right now you'll see that I'm standing on my right foot, and there's very minimal weight transfer to the left. I tap the toe just for a guide. So we're starting in the sagittal plane, which most of us are good at, and I'm rocking forward and back. Important part here is every time my toe touches the ground, my right knee is bent. So both directions, whether my left foot is behind me or in front of me, my right knee goes over my toes and creates that dorsiflexion of my ankle. Okay, then the next part will be the frontal plane movement, and you'll see the ankle move and the knee kind of rotate in. It's actually not rotating, but what you'll see how will happen is as I move my body and my foot to the left or to the right, so the left here, you'll see my knee is going in, creating a pronation of my right foot. When I go back to the right, the arch rises and comes up off the ground. Last dimension of movement that we haven't talked about yet in the stability part is the rotation. So what we're doing here is when I rotate to the inside, to the left, I still want that right knee to be bent because that protects the knee a little bit, but it's allowing my foot to pronate. And then as I rotate back to the right, you'll see my arch comes up off the ground, and you'll also see that my right knee straightens slightly. So So with these exercises, I would recommend you do these before you run. They're very good for people with plantar fasciitis and rigid feet. So it just gets your foot ready to help absorb the shock of running, and can help you run safely. And there's a lot of bones in your feet, so trying to make sure that they all work well and all the tissues around the area are stabilizing the ankle and the foot. It kind of engages all of that so that when you're running, the first thing that touches the ground is your feet. So if they're not right, other things are going to have problems. So you'd probably do 3 to 4 passes through of each one of these type of movements pre-run. Shouldn't take you more than a couple minutes.